welcome everyone. Thank you for joining me tonight. I'm excited to be here and to share this information with you and to show and discuss really how healthy ears and healthy hearing can lead to a healthy life. We're going to look at a couple of different questions tonight. First, we're going to talk about how common hearing loss really is and what are the types of hearing loss. We'll look at how do you know if you have hearing loss and if there are risks of untreated hearing loss. And last, we'll try to look at how we can treat that and prevent those risks. So as Carrie said, I'm Dr. Ryan Casserly. I'm an otolaryngologist by training. That's an ENT. I'm specifically a neuro-otologist, and that's my fellowship training. That means I specialize in outer and middle ear disease. I work on hearing restoration and treat balance and vestibular disorders. I went to medical school at USC and did my residency at the University of Maryland and completed my fellowship with Dr. Michael Teixeira. About 2 years ago, I joined Central Coast Head and Neck Surgeons and joined as an attending physician at the community hospital. And many of you may know that there are 2 Dr. Casserlys in the area, and yes, that is my wonderful wife, and here we are with our 2 sons. So why hearing loss? Well, hearing loss is really common and it's really important. If you ask the World Health Organization, we can find out that about 1.5 billion people experience hearing loss across the world, and that can significantly impact their life and their families and their social, society, and countries. But perhaps one of my favorite quotations is from Helen Keller, and she said that blindness cuts us off from things, but deafness cuts us off from people. And that is really poignant and important to talk about because we can look broadly at this across the world, but truly it is very personal. So let's zoom out, look at the big picture here across the world. 20% of the world's population has some form of hearing loss. That's huge. And 5.5% of those people have hearing loss that impairs their daily activity and their quality of life. And that's because they have moderate or greater hearing loss. But we should kind of look at that and dive into what those different categories of hearing loss look like because they'll be important for the rest of our talk. So we talk about hearing loss as normal hearing or mild, moderate, severe hearing loss, and in its most severe form we call it profound. But if we look at that in terms of how it changes your day-to-day activity, I've highlighted those in blue and green. So for mild hearing loss, that means that an adult might have difficulty hearing conversation in a noisy environment, but in quiet they'll do just fine. But if someone has moderate hearing loss, they're going to have difficulty hearing conversational speech even in quiet environments, and in a noisy environment they would have difficulty hearing and taking part in a conversation. And it only gets worse from there. More difficult and taking more mental power to really hear, listen, and participate. If we compare hearing loss to other categories, other diseases that we spend a lot of time talking about in medicine, the numbers are pretty surprising. Hearing loss, if we look at the prevalence across the world, and these are WHO numbers, and this is hearing loss that is moderate or greater, there's 275 million people with moderate or greater hearing loss. Compare that to osteoarthritis, that's 151 million people. Diabetes is 220. Asthma is 235, and low vision, which is perhaps maybe the best analog, is 272. So pretty close, but still less than hearing loss. And if you think about all we do for vision and how many people you know wear glasses or contacts and have readers in every room at the house, that really sounds like a huge disparity between what we do for vision and what we do for your hearing. Hearing loss gets worse typically as we age. At 70 years old, about a quarter of people have at least moderate hearing loss, but that increases to 50% by 85 years old. And you can see how that curve really increases as age goes up. So it's important to identify this and work with this because it's normal, it's common, and it's expected. So what do we do for screening for hearing loss? Well, we start early and we do it well with kids. Every baby in the United States has a newborn hearing screen. Here's a little one with the otoacoustic emission testing apparatus on. Most kids in school will have school testing. You'll probably remember having a van come to the school at some point. And many pediatricians in well child visits will do hearing screens as well. Once we get to adulthood, It's only for people who have high-risk jobs or high-risk exposure when there is workplace testing. And truly, there's really no routine testing thereafter unless you mention it to your doctor or there's something that kind of prompts that. So I was going to ask the audience here, when was the last time you had a hearing test? And we should be able to do a kind of a raise of hands here. So if you've had a hearing test in the last 2 years, can you digitally raise your hand? We'll see what people say. Carrie, is that working? I can't hear Carrie at the moment, so I'm not sure if that's going to work.
Oh, I apologize. I was on mute.
Okay.
Uh, no, it is not working. I'm sorry, Dr. Casserly.
No worries. Okay.
Yeah.
Well, let's move right along then. We want to talk about the types of hearing loss and the causes of hearing loss. And we're going to show this diagram of an ear because types of hearing loss are really divided by anatomy. So here you can see an outer ear, an ear canal, the tympanic membrane or eardrum, and the three hearing bones coming together, the incus, the malleus, the malleus, the incus, and the stapes, and then the cochlea. And this organ, the cochlea, is responsible for transmitting those vibrations into electric signal for the brain. So if we look at the two major categories for hearing loss, we talk about sensory neural hearing loss and conductive hearing loss, and I've given you some examples of those. So perhaps the most common type of sensory neural hearing loss is presbycusis, or age-related hearing loss. And that's because the inner and outer hair cells in the cochlea start to wear and degrade, and your body can't regenerate those. And so the ability for them to change vibration from the outside world into signal for the brain stops. This can happen over decades, and we call that age-related hearing loss, but it can also happen acutely if there is a noise-induced trauma, or perhaps repetitive trauma in the workplace or recreation. And so that's noise-induced hearing loss. In contrast, we have conductive hearing loss, and this is really an issue with sound reaching the ear. And some examples there would be things like otitis media and otitis externa. Otitis media is just our way of talking about an ear infection and there being something like fluid or pus behind the eardrum. And otitis externa is what we would normally call swimmer's ear. There's something in the ear canal that's blocking it. As another example, we would have otosclerosis. That's when that last hearing bone, the stapes, becomes stuck and can no longer transmit those vibrations. So let's go back and look at our diagram here. So the conductive hearing loss category is everything in purple, and you can see that involves the ear canal, the eardrum, and those three hearing bones, as opposed to sensory neural hearing loss, which really is involving the cochlea and the transmission to the brain. So if we use that framework and look at different types of hearing loss and causative factors, you can see that there are many causative factors and protective factors across the lifetime, and I want to dive into those specifically for adulthood. And we'll use those categories. So for sensory neural hearing loss, you see two of the ones we've already talked about. That's age-related hearing loss and exposure to loud noise or sounds. And again, that can be over a repetitive nature or something that's acute. But there are other things to think about as well, like ototoxic medications. Perhaps the most common type of medication in this category would be chemotherapy. There's a whole category of chemotherapeutic agents that really can damage the ear, and we work very closely with our counterparts in oncology to make sure we monitor that, test for that, and help our patients avoid hearing loss as best they can. There are also viral infections that can cause typically what we call sudden sensory neural hearing loss, and that is a type of sensory neural hearing loss, of course. When we look at conductive hearing loss, we've talked about otosclerosis and otitis media or ear infections, but perhaps the most common type of conductive hearing loss that we see in the office all the time is earwax. If you have an ear canal full of wax, it absolutely will attenuate your ability to hear and decrease your hearing. So sometimes when someone comes into the office and tells us that they can't hear, we're relieved to find that it's just earwax blocking the canal. We clean it out and their hearing is so much better thereafter. Sometimes these two categories of sensory neural hearing loss and conductive hearing loss overlap. And you can see I've listed two different causative factors there, genetic factors and trauma, and those can lead to both types of hearing loss and cause a mixed hearing loss. So what are the signs for early hearing loss? What should we be looking for? What should you be looking for? Most patients tell us one of the earliest things they can find is difficulty understanding conversation. And I do make a point to say understanding here and not just hearing. It's not that you can't hear that someone's speaking, it's not that you can't hear the words, but sometimes understanding the words is a lot more difficult. And that's because we can hear the consonants and the vowels differently, and that makes it harder for us to understand the words. And we'll talk a little bit more about that in just a moment. A lot of patients have difficulty hearing in noise. And what does that mean? Well, if you're out to dinner, if you're at a coffee shop, if there's some ambient noise, it's that much more difficult to hear and to understand because your brain is having to decipher and sort through both the words and the background noise. If your ears don't have an equal amount of hearing loss, if something's asymmetric, it can be very difficult to localize sound, and this can be particularly dangerous if it's in the parking lot and you can't find out where the car is coming from. But it can also be very frustrating if you're trying to find your partner in the house and you can't hear their voice. But probably the most common thing that we see in the office all the time is a family member's report of hearing loss. You know, my partner can't hear anymore, the TV's too loud, he can't hear what I'm saying when I call for him, and that definitely clues us in as well. A very common sign of hearing loss is tinnitus, and tinnitus is very common, and probably the most common cause of tinnitus is hearing loss. But tinnitus is a pretty broad topic and has so many nuances that we could probably do a whole separate talk on that, and maybe we should. But I wanted to share this diagram with you in that most of the tinnitus is coming from these damaged hair cells inside the cochlea, and your brain is filling in the gap with the tinnitus. But there are also types of tinnitus that come from the flow of blood going behind and around the ear, as well as some inflammation in the jaw joint, the TMJ, and even things like auditory migraine. So that's a whole different topic, and we can talk a little bit about that more later if needed or wanted. So how do we figure out if you have hearing loss? Well, there are some screens and there are some tests. There are free hearing screens, and probably one of the better ones is through the AARP if you're a member. You can do this for free on your phone. It doesn't give you any specific information, but it might clue you into needing a real hearing test, and we call that an audiogram, and that would be done by an audiologist, typically in a doctor's office, like my office. And we'll test for your frequency and your speech and give you a printout there, and also look at how your eardrums are moving, if they're blocked or stuck. We'll do acoustic reflex testing to make sure that your hearing is going to the brain and the brain is responding with the muscles behind the ear. And in some specific situations, for instance, pediatric testing, or for things like subclinical hearing loss with chemotherapy, we can do otoacoustic emission testing where we make a sound and chirp at the ear, and the ear actually chirps back and can let us know if the outer hair cells are functioning normally. I gave you a little example here of an audiogram with asymmetric hearing loss. So down here we have low frequencies and we go all the way up to high squeaky frequencies. And on the vertical axis we start with very soft sounds and go all the way down to very, very loud sounds. The left ear is in blue, it's in X's, and the right ear is in red, in circles. And you can see that the ears are doing different things. The left ear actually has normal hearing and the right ear does not. It has a mild to moderate hearing loss. And so these are things we look for. I wanted to share with you an audiogram of common sounds because it's helpful to compare the things that we hear in our everyday world versus where speech shows up in an audiogram. So again, the same layout, low frequencies up to high squeaky frequencies, and very soft down to very loud. You can see some common things that you might hear in the course of the day. A lawnmower, a piano, vacuuming, a siren. But this big yellow shape here, we call it the speech banana, is where words and sounds that we hear for speech typically show up and we've interposed it here on the audiogram. So the sounds like SH, CH are here. Look, K is up here, and F and S and TH are way up here in a very high frequency, as opposed to some of the vowels, which are lower in frequency. And so it's oftentimes that patients tell us, well, I don't think I have hearing loss because, I can hear my neighbor's dog barking and I can hear, the vacuum just fine. Well, that's maybe not surprising because they're down here, they're outside of the speech bubble. Perhaps a better question would be, well, can you hear whispering? Can you hear the birds chirp? Can you hear the rustling of leaves when the wind blows? And these are more sensitive measures. If we look at how this changes across our lifetime, it's a very interesting picture. So we typically lose high frequencies as we get older, and this graph is showing decade by decade how those high frequencies drop off for women and for men. And yes, men tend to lose high frequencies more severely than do women. And if we look at what that shows when we interpose that same speech banana, we can see that as we age, yes, those sounds come out of the speech banana, and those are the sounds, those high frequencies, the consonant sounds that we're losing. And in that way, we lose the meaning of words because we can't hear the CH or the SH or the T sound. And it's so much harder for us to understand words if all we're getting are vowels. So what are the challenges with hearing loss? Well, there are several, but I want to highlight 4 tonight with you. We're going to highlight social isolation, imbalance, decreased productivity, and cognitive decline and dementia. We have seen quite clearly that hearing loss can lead to social isolation and loneliness. And why is that? Well, people typically start declining invitations and stop going to social events. They're trying to avoid embarrassing situations. And this is often because there's increased cognitive load when you're not hearing well. People feel like they're just mentally not as sharp as they once were because they're trying to pay so much attention to just putting together what someone is saying that it's that much harder for them to participate. I actually had a patient visit with me this week who told me that she was embarrassed to be around her grandchildren because they always were having to repeat themselves for her to hear what they were saying, and she was just beside herself because she wanted to be, a grandmother that was participating and active and there for her grandchildren, but she just felt embarrassed to always be asking them to repeat. And in doing so, she's seeing them less. And so I think that was a really personal example of how this plays into our social lives. We have also seen that hearing loss can cause increased imbalance and potentially falls. In a study that was done between the University of California at Irvine and Harvard, they saw that the increased frequency of falls increased by 3 times for people with hearing loss. And that increased hearing loss correlated with the rate of accidental injuries. So the more hearing loss people had, the more they self-reported accidental injuries and falls. So if we can help correct this and be on top of screening for it and identifying this issue, people can be more balanced, more stable. And as a little anecdote here, I actually had a patient tell me that he just got a new pair of hearing aids. He's been wearing them all the golf course, and his golf game is now somewhere between 12 and 15 points better, and it's consistent. It's been going on for about 3 weeks, and all of his golf partners are very jealous now. Going on here, we can also see that hearing loss can cause decreased productivity, and this is across a lifetime. We can see that for young people with hearing loss, they're half as likely to achieve higher education if they have hearing loss. People with hearing loss are twice as likely to be unemployed, and if they are employed, they earn lower wages and they're more likely to retire early. And that just really gets in the way of people living a fulfilled life and contributing. And this study was specifically for work, but we see the same thing after a career, let's say, but for volunteering and being involved in a community and participating in community activities. And the last hearing challenge we wanted to talk about was with regards to cognitive decline and dementia. And this is something we're really trying to focus on. There's ongoing studies looking at this, but in the Lancet Commission, we did find that over 8% of cases of dementia were directly attributed to hearing loss among older adults. And we do see that there is an increased relative risk of dementia and cognitive impairment that correlates with hearing loss. So we're really trying to figure out how we can mitigate this and help people, but we do think that this is because of the social isolation and the decreased productivity, and making sure that people aren't withdrawing and becoming less vivacious and active and mentally stimulated. So what do we do about hearing loss, and what are our treatment options? Well, the first step is a thorough audiogram, and I really recommend all of the audiograms to have speech testing. It's helpful to meet with a physician like myself to review the diagnosis, talk about whether it's sensory neural hearing loss or mixed hearing loss, conductive hearing loss, and how to sort through that. But perhaps the first step in treatment is really reviewing communication strategies with your family and friends, talking about, hey, I have hearing loss, and this is what I need you to do to help me to hear better. It's about sitting in the right place when you go out to dinner and making sure that we limit those distracting sounds so that you can hear as best as possible. In many situations, particularly for moderate hearing loss and above, we talk about hearing aids. And there are all sorts of different varieties now, and they've really come a long way. And it's important to note that for many people, they really can help with tinnitus. And in situations with severe or profound hearing loss, we sometimes talk about cochlear implants, and we'll talk about that in just a second. These are our two audiologists. This is Amanda, this is Robin. And there are doctors of audiology in our office. They help all of my patients with their audiograms and hearing aid consults and cochlear implants. We're really fortunate in our office to have this service for our patients, which is VeriFit testing and speech mapping. And I bring this up because if you're going to invest the time and effort to get hearing aids and use them, we want to make sure that we can maximize their benefit for you. And so by using the VeriFit, we put the hearing aids in your ears, and then we use this machine to test the hearing aids in your ears and make sure that they're giving you exactly what we think they should be giving you, and mapping your speech and how that should work for your ears in your situation. And we often are able to really improve the usability and benefit of hearing aids over just a standard programming with this. I also wanted to show you not some slick advertisement for some of the hearing aid companies. This is Robin, and she's wearing a pair of our demo hearing aids. And these are just photos we snapped in the office earlier last week. So you can barely see it, but there's a thin cable here. It's a little easier to see when we zoom in, but that's all you see on a profile view here of Robin. But the processor is hiding back here behind her ear, and I just wanted to show you how inconspicuous and really subtle these can be now, because they're so small and hide so well. And here's Robin using our VeriFit and tuning that hearing aid and mapping that. So what about cochlear implants? Well, this is a big change for our community. I'm thrilled to tell you that we have made the service available to patients in the area. I'm actually the only cochlear implant surgeon between San Jose and Los Angeles, and I'm grateful that the community hospital has been so willing to work with me on this. And when do we do cochlear implants? Well, we do this when hearing aids are not enough, and that typically is an issue not just of volume, but of clarity. Hearing aids can only give you more volume, but as our hearing degrades and declines, oftentimes we lose the clarity, and we will test for that specifically in the audiogram. And at some point we understand that hearing aids aren't just going to give you enough, and it's still going to sound garbled. And that's really where cochlear implants have made a big change and a big difference for people in the past 50 years. They're designed for speech understanding. They're going to give you back that clarity and that volume together. So here's me doing one of our cochlear implants. And here's a patient with a cochlear implant. And you can see she has one of the new single unit devices that's held on with a magnet here behind her ear. So nothing on the ear, it's all behind. And this is communicating directly to the implant and the electrode. What does that look like? Well, there's a part that you see and there's a part that I see. A cochlear implant works by having this device on the outside of the ear. This is the microphone and the battery and the processor. It attaches with a magnet to the implant. That's the part I put in a surgery that is about 90 minutes to 2 hours long. And there's an electrode that goes all the way through the cochlea, and here it is zoomed here, so that we can directly stimulate the nerve in the cochlea. That nerve isn't getting the stimulation from those hair cells that I showed you earlier because they've been degraded and aren't working properly. So instead we use this electrode to directly stimulate that nerve and send signals for your hearing directly to the brain. So this part you never see, that's all on the inside, and that directly stimulates. And the part on the outside can be this two-part, or in the newest ones, as you can see this young lady here, just the one unit that's sitting above her ear and kind of off the ear. So we're really thrilled that these have come such a long way and are really helping our patients hear more and participate more and really reconnect. So in conclusion and review, I hope I've shown you that hearing loss is very common, and it's even more common than low vision, and that really demands that we do more about it and screen more and talk about this more because it is all around us. There are various types of hearing loss, and it's important to understand which type you might have and how we can treat that best. The first step in doing that is looking what's going on with an audiogram and having that reviewed. We've talked about how the risks and impairment with hearing loss are broad and far-reaching and can make a big difference in someone's life. But I hope I've also shown you that treatment is available, it's common, and we can do a lot to improve your hearing and mitigate these risks. So with that, I'm going to hand it back to Carrie. Thank you for your time and attention, and we'll go over some questions.
Yeah, if you have a question, please type it in the question and answer box, and we will monitor that and try to answer your question. Dr. Casserly, do you have to be referred to have an audiogram? Like, do you have to have a referral from your general practitioner?
That's a great question, Carrie. It honestly depends on the insurance that you have. We are always going to try to look at your ear and meet with you before the hearing test in our office because we want to make sure that the ear canal is clear and not full of wax or anything else. So typically when you get a referral, it's to the office in general. We take a look, you get a hearing test, and then we review those results together.
Okay, thank you. Question about tinnitus. I myself, I will, when I drink red wine, seem to get tinnitus. I know people who have said that they feel it happens when they eat gluten or something like that. So is that an allergy, a sign of an allergy, or what's going on there?
Yeah, that's a really common thing that is often overlooked. But tinnitus can be a sign of a trigger in your nervous system for a hypersensitivity or a hyperreactivity. Sometimes we even give this the label of almost like an auditory migraine. But we know that red wine and things like gluten can be a trigger for migraine headaches, but it can also be a trigger for the auditory version of that, which is tinnitus. So your system probably is getting triggered by that, and this is kind of the alarm.
Okay. Thank you. This is a question that actually there's somebody that's been asking about earbuds, and this was a question that my coworkers and I had for you also. Listening to music and movies too loud or with AirPods, does that contribute to hearing loss, or is that a myth that your parents tell you?
No, that's something that we've been looking at quite frequently and obviously more recently because of the advent of Bluetooth earbuds and where people wearing these mobile devices. So what we do understand is that putting headphones on or earbuds in is not necessarily damaging to your ears unless you're listening at a very high level. But the important thing to remember is that we want all of our patients and everyone to be listening at the lowest possible volume so that it can protect the ears in the same way. Use the least amount of volume that you need. And why there has been such a bad reputation for things in the ear canal is that rarely do they seal the ear canal. So if we take the example of someone wearing like the first version of AirPods, they didn't have anything to seal the ear canal, and if you're on the subway or the train or in a noisy environment, you're still listening to all the sounds in the environment, and you're turning up your earbuds even louder to overcome those sounds, as opposed to the more traditional over-the-ear headphones. And in doing this with that big headphone, it's canceling out the sound just by blocking your ear. So we know that you could have the volume lower by about 5 to 10 decibels, and that does make a difference over time in protecting your hearing. Now, some of the newest earbuds or AirPods do have a seal because of this feedback, and that seems to be a healthier option.
Okay. And then, that kind of can bring into the everyday tools that we use around the house, like hair dryers and vacuums and, gosh, you name it. And I don't think that it's really easy to not think about how that could be damaging your hearing.
Absolutely. There was an interesting article, paper recently about how loud hand dryers are in shared bathrooms. Everyone's trying to use those to turn away from using paper, but particularly in a bathroom where everything is in tile, for hygienic reasons, all the sound ricochets and vibrates, and it can actually be very, very loud. And it was even particularly loud for people of lower height. So kids are more affected by this because of where their hands and ears are relative to the machine. So the short answer is that we have to be careful for those things because things can be very loud. The good news is that even for loud sounds, the shorter it is, the less likely it is to cause hearing loss. But if a sound is very loud, it can be brief and still cause temporary, if not permanent, hearing damage.
Okay. All right. Thank you. A couple questions here about, short of an implant or clearing hard wax, are there other treatment options? And then to that, what's the second part of that would be, what's the safest way to remove earwax?
Sure. Well, for things like sensory neural hearing loss, what your brain needs is more volume in most situations. Sometimes it needs more volume and more clarity. So if it needs more volume alone, things like hearing aids are going to be the safest and easiest option for most people, or you can turn up the volume on your phone or the TV or things like that, and that's often what people notice as an early sign of hearing loss. Cochlear implants are definitely the most advanced option here and reserved for the most severe hearing loss issues. What's the safest way to clean out earwax? I'm a little biased, but I think it's coming to see an ENT doctor. Many people like things like Debrox or drops that you can use with peroxide. And those are often helpful if there's just a little bit of wax in the ear canal, but we do see that oftentimes, this just happened yesterday. I had a gentleman in the office, a young guy, lots of earwax on both sides. He used Debrox for several days in the course of a week and felt like his wax problem got worse. And that's because the wax got more wet and created a seal in his ear canal, and his hearing actually got worse because of it. So it's a tricky balance sometimes, but oftentimes it's just best for us to look, or your primary care doctor to look and flush that out. In our office, we don't flush it out, but we use fine instruments under the microscope to take that out, or a vacuum.
Okay. So, what about earwax candles then? What do you think?
I will tell you, honestly, I have tried them, and having cleaned out people's ears, multiple times every day, I can tell you the stuff that comes out of the earwax candle is not what comes out of your ear when I clean it. So I don't think that it's the same. It's very impressive sometimes, but it's really not getting anything out.
Okay. All right. Thank you. Has there been any connection with COVID-19 and hearing loss? And then somebody also asks about diabetes and the connection, if there's a connection for that and hearing loss.
Yeah, let me address the COVID question first. There absolutely has been a link with COVID-19 and the SARS-CoV-2 virus in the inner ear. We see that virus can directly damage those inner and outer hair cells. That paper actually just came out about 3 weeks ago and was published in Nature. So we do see that. It is an area of ongoing research. but certainly there have been reports of increased tinnitus and increased hearing loss. In the beginning of the pandemic, we didn't see that those numbers varied drastically from reports in the community prior to COVID. But now that we see that there is more molecular damage or cellular damage happening here, we're going to keep looking at that and researching that. With regards to diabetes, this we think tends to be more of an issue with the blood supply blood supply problems that we see commonly in diabetes, and those very fine blood vessels that travel through the inner ear, and there being vasculitis there and blood clots or blood blockages. So that can damage the ear, but we don't necessarily think that it is a distinct risk factor.
Okay. Can you, another question, can you get a cochlear implant in both ears?
Yeah, that's a wonderful question. Thank you. The answer is yes. We don't typically do them at the same time unless you're a child and we have seen that there's no functional hearing in either ear. So in that situation, more and more facilities and doctors are doing what we call bilateral simultaneous implantation. But for adults and people in their, middle of their life, we typically do one side at a time. And then if the other ear starts to decline more, we redo the testing for candidacy and look at implanting the second ear. I actually just helped a gentleman with his second cochlear implant. He got his first one about 10 years ago with a different surgeon. And over those 10 years, he was wearing his implant on one side and a hearing aid on the other. And then he started feeling like the ear with the hearing aid just wasn't keeping up. And so he has gone ahead and we did the surgery a couple weeks back to put the cochlear implant on the second side. And now he has both cochlear implants working and is working to have those kind of work in harmony and synchronize.
Okay, that's awesome. Well, how would hearing loss cause a fall?
Yeah, that is something that we are looking at more and more with these studies because it's hard to kind of zoom in the moment when it happens. But what we do see, and this is not just for imbalance and falls, but also for the cognitive decline portion of the hearing loss challenges, the issue here is that your brain is working harder and exerting processing power, if you will, to manage the hearing loss and try to understand more. That processing power should be going to your balance and other mental activities, but it's not. And that's why we think there's issues with imbalance and falls.
Are there helpful sources that cover living, coping with hearing loss as a family?
Yeah, that's a good question. I would turn people to, I think the one that comes immediately to mind is ASHA, which is the American Hearing and Speech Association. AARP probably has, they definitely have some good resources as well, particularly for older individuals and families. Those are the two that come to mind.
Okay. Alrighty. Well, thank you so much.
Well, thank you, Carrie.